righty, thank you all for being here today. Once again, if you have not already done so, please mute your line by pressing *6 or using your phone line's mute function. So we will go ahead and get started. Today's webinar will feature a very special opportunity for local health departments from the Emerging Leaders in Public Health program of the Kresge Foundation. We will also be exploring some transformative change through health equity from 2 local health department examples who have been engaging in this process. Today you will hear from a couple of our presenters, or a few rather. First, you will hear from Janet Suttie. She is the project director of the North Carolina Institute of Public Health, which is the place that now houses the Emerging Leaders in Public Health program for the Kresge Foundation. Janet will share some background information on how this program came to be and its purpose within public health. She will also be sharing an opportunity for our local health departments that are on the line right now. Next up, we will have Julian Drix of the Rhode Island Department of Health. His Emerging Leaders in Public Health team partner, Dr. Alexander Scott, pictured on the left here, will not be presenting today, but I would like to recognize her efforts in promoting a health equity agenda within Rhode Island. Julian will share some more information about how they are doing this and how the Emerging Leaders in Public Health program is an avenue to further advance their efforts. Following Julian, you will hear from Margaret Reed of the Boston Public Health Commission. Her Emerging Leaders in Public Health team partner is Monica Valdez-Lupi. She will not be presenting today with us, but she is pictured here on the left. We would also like to recognize her for her efforts to promote the everyday practice of equity within Boston. Margaret will share some information on how they are moving forward with this through their own transformative concept. So without further ado, I will now turn the table over to Janet Suttie of the North Carolina Public Health Institute.
Thank you. Thank you very much, Jessica.
Hello,
everyone. I really appreciate this opportunity to share with you some information about Emerging Leaders in Public Health initiative that's being sponsored by the Kresge Foundation. And what I would like to do in this presentation is give you both an overview of the program, give you a little bit of background information about why the program has been initiated, and also about the opportunity that Jessica mentioned to be able to join and participate in our next cohort, which we are going to begin recruiting starting next week. So I want to mention that I am speaking to you from the National Institute for Public Health in the UNC Gillings School of Global Public Health in Chapel Hill, North Carolina. And I want to mention also that we're having a lovely spring here in the Southeast, which means I'm also having allergies. You may hear me pause for a moment just to take a drink. So I apologize if you hear some silence. So next. I want to acknowledge that we have 2 very wise program officers from the Kresge Foundation who are working with us. Dr. Phyllis Meadows is a senior health fellow in the health programs part of the Kresge Foundation, and she is the person who spearheaded this initiative. So it's her brainchild that we are trying to implement through the National Program Office. We also have Stacy Barbas, who is a senior health program officer with the Kresge Foundation and provides a lot of experience helping to work with our National Program Office. Next. Here is the leadership team at UNC. On the left is our principal investigator, Anna Shank. We also have an evaluation specialist, Lori Carter-Edwards, and a workforce development specialist, Janine Herrick. I am the program officer, and Steve Orton is our co-principal investigator on the team.
Yes.
Next. So one of the things that I think many of you might be aware of if you work for local health departments is that these departments play a really critical role in our country to help fuel the prevention efforts and to really bring about improvements in population health And however, according to the Fred Hutchinson Cancer Research Center Public Health Science Division, in 2014, less than 3% of the total health spending is for public health, which is fairly alarming. We have also Nature reported in 2013 that 38% of local health departments across the country reported job losses, and we have about 2,800 health departments throughout the country. So this is a significant loss of workforce promoting prevention and public health efforts, as well as 28% of those health departments experienced budget cuts. So the Kresge Foundation, reading reports like this, felt like this was a trajectory that they wanted to change and try to move into an upward motion. They want to help increase job availability in local health departments. They want to increase funding in local health departments and really bring about more visibility to the important work that local health departments do. So they went around the country and surveyed more than 100 public health experts and leaders to find out why they thought we were seeing this downward movement of both the workforce in public health as well as the funding available for those efforts. And they learned from those leaders that many of them have ideas about what things they could do to help implement change in their health departments to create a stronger and more sustainable future for that department. And that what they needed was actually leadership training and leadership development resources. So those were based on that feedback, the Kresge Foundation initiated Emerging Leaders in Public Health program, which they piloted with a small group in 2015 and 2016, and then recruited a national program office where I work to help put this up to full scale with the second cohort, which began in 2017. And as I mentioned, we'll be recruiting our third cohort beginning next week. So I'll talk a little more about that later. Next. So the purpose of this program is really to try to help support current and future public health leaders. And again, some of the feedback that the Kresge Foundation received was that there are health leaders out there who think they have good ideas of how they can strengthen their health departments. So we're trying to support those leaders in advancing transformative roles. And then we are trying to assess with those health department leaders how they can position their health departments for new opportunities so that they can succeed in this type of environment we're all in right now, where we're seeing a lot of change. There's change in health policies, there's change in health funding, there's change in political climate, there's change in social climate. So we know that even though you can plan for things that you can definitely predict, there's types of leadership skills that you need to develop if you're going to be trying to lead your agency through change. So we're trying to help provide leaders with support for that, and then through the development of these three cohorts, bring together and try to start initiating the formation of a larger network of transformative public health leaders. Next. So our objectives are to identify those leaders that are highly motivated to try to make change within their health departments that's going to strengthen that department and position that department for more opportunities and lead their health departments into the future. So we're going to be providing those leaders with the knowledge and skills that they're going to need to advance that type of organizational level and systems level change. Where our job is to really help both provide training but connect leaders to a broad sector of other experts in the field of both public health and outside of public health that can help those leaders gain some skills and gain some tools to use to help their work in doing that transformation. And again, our job is to support and facilitate that development of a shared learning community both within public health and outside of public health. Next. So the leaders themselves have objectives And their objectives are to develop and apply those leadership skills that they're learning through the program to advance a transformative role in their agency. So this is really a learn by doing type of program or initiative. We call it action learning. There will be things being implemented within your health departments if you end up participating in the program that you're going to be doing throughout the whole program period. And we're hoping that as a result of that learning by doing, we are starting to give leaders a chance to gain adaptive, what we call adaptive leadership skills. And the model is to have not just a single leader in that health department participate, but basically to have two leaders within the team participate, because we know there's a lot of benefits for having leaders in different levels in the organization being able to take their insights and share their perspectives and work and be accountable to each other to try to move any initiative forward. And also one thing that's very critical that the leadership teams need to be able to do is learn how to communicate and leverage communication in the work that they're doing transformatively. They both need to be able to communicate well to gain buy-in from their internal staff and leadership teams within their health departments. They'll need to be able to communicate effectively to gain the interest and the partnership with stakeholders that are external to the health department, which may mean even developing new partnerships with stakeholders that are not in traditional public health agencies or organizations or businesses. And then another aspect that we really feel the teams will be able to gain some experience doing is to start promoting and marketing their health department for this new role that they're going to be playing and gain some visibility and influence in their community. Next. So we're really hoping that as we work with our leaders, that they will be able to understand the difference between what has been sort of a traditional public health project and what we're considering the impetus and the goal of the program, which is to basically think beyond traditional public health, creating roles that are innovative, new, and very important and critical and essential for the community. So just to help you understand a little bit about that difference, because I think many of us, if we've worked in public health a long time, we have more of a project oriented mentality, and we understand how to do a project. But what the ELF program is doing is trying to stretch leaders to really think more about doing, assuming new roles in their health department, developing those roles, things that are not typically done by health departments. So that means for us that they will be willing to assume and develop new core functions and duties in their departments that can fill a structural and functional gap. And I'll give some examples in a minute or so. One of the things that's very important there is that the health department is not just assuming that role kind of in an invisible way, but is doing that in a way that others who are going to be impacted by that new role can join the health department in supporting them doing that role. So this is kind of the difference between what we think of as traditional public health and transformative public health, where you create a transformative role for your agency that can respond to the changing health environment and position yourself for more sustainable funding opportunities, as well as increase your agency's influence and visibility with those stakeholders, with your legislators, with any other entities that actually can provide funding to your department, and then by that strengthen your department for the future. Next. So here's a couple of examples that I pulled to try to illustrate that point about what is a new role for a department as opposed to what is a new project for a department. And in cohort one of the departments decided that they wanted to transition into serving the role as the main safety net provider for adolescent behavioral health services within the school system of their community. So this is a role that they didn't play, but they saw that there was going to be a need. They would be able to work with partners to set it up and create funding. So it meant for them to work across sectors in their community to achieve this role, as well as do some capacity building within their organization and get stakeholders from outside of their organization on board. So in contrast to that, we would say if you recognize the need for some behavioral health services in the school and decided to set up a screening test for adolescent depression and then develop an intervention, that in itself is not really the same as assuming a much broader role where, again, it's working towards creating new duties and functions within the organization, the health department itself, that can fill a structural and functional gap within the community. So try to keep that in mind as I'm trying to describe this, because it's a little bit difficult concept, I think, to grasp. And another example here is that one of our current cohort members is going to be working to become recognized as a criminal justice reform strategist for their community. So how they're doing that is they're working with many organizations across different sectors in their community, including the mental health organizations, the clinical organizations, the jail system, the court system, and their public health department. They're bringing all of those stakeholders together to discuss what ways they can try to look at information that they all have separately to be able to develop strategies that might help reduce incarceration rates in their community. So I don't know, Jessica, I can hear some music in the background.
Someone put us on hold. I'm trying to find them to mute them.
All right, that's fine. So I'll keep going if people can hear me over that music. Okay. Okay, thank you.
Are you there? All right.
Yes. So in sort of as a contrast to the idea of becoming a reform strategist and being recognized as the go-to for trying to develop criminal justice reform strategy and policy, an idea could have been they might have just conducted data analysis across sectors to determine community incarceration rates, which certainly is a valuable thing to do. But it's not the same as actually, again, creating a broader type of role for yourself to play where you're recognized as performing this role as the strategist. So people come to you for that information rather than you being used as potentially a smaller piece of a bigger role. Next. So I want to mention that one of the two teams that we have today will be describing a little bit about their roles, and they in particular have decided to focus on advancing health equity as kind of the centerpiece of their transformative role. And I think you'll probably get a better idea about what we mean by a role when you listen to their presentation. And I see I'm running out of time, so I'm going to try to go through this fairly quickly. So the model for the program is that it is an 18-month action-oriented experience. We will be selecting 20 leadership teams, that's 20 health department teams, with 2 teams from each health department or 40 leaders, and we'll be asking those leaders to, again, apply their idea for what kind of new role or transformative change they want to implement in their health department, and we'll provide them with some leadership development to do that kind of adaptive leadership for organizational change. And we will be monitoring and really working with you to help follow what kind of real-time change you're experiencing and to troubleshoot any obstacles or problems you run into as you do this work. And you will also receive, if you are selected, financial support for doing this. And that financial support can be up to $125,000 for your agency. Next. So these are the different components that are part of the program. We have in-person 2-day trainings. There are 4 of them over the 18 months. We also provide some web-based learning in between those convenings. And we work with the teams to really create their applied learning resource grant proposal that they submit to the Kresge Foundation that describes how they're going to do their transformative work. They can use some of that money to help hire consultants to work with them in their health departments, to hire executive coaches, to hire mentors, to hire trainers. So they can use a lot of that funding to really do the work needed to advance that new transformative role. And we will be training you how to do peer learning through what's called action learning protocols, which is a way for senior leaders at multiple health departments to join together and do problem solving together. And then at some point in the program, when NACHO holds their annual conference, that's in July, that'll be about 12 months into the program for the next cohort. We'll ask the cohort to attend that meeting, and that'll be an opportunity for them to share some of the work they're doing, even though they won't be through with the program, just some of the lessons they're learning, and get feedback from their peers at the conference. Next. So right now we have these are the cohort 2 and cohort 3. Cohort 1 and cohort 2 teams, which represent 32 health departments from 23 states across the country. So we will be, as I mentioned, starting to select our next group of health departments in April and May, expecting to choose and select the finalists by the end of June. And we are hoping to receive some applications that are strong enough to be part of the program from some of those states that we don't have applicants from yet. Next. There are 2 steps to doing the application process. So you can submit your application request form at www.kreski.org/ELF. And I believe that this webinar will be available to you to go back and listen to, and these slides will be available so you can get this website at that time. We are asking that only 1 application request be submitted per agency, and that once you submit that, you're going to receive a unique application link, and then you submit 1 application per health department, which again we will be reviewing in April and May, and then doing our finalist selection by the end of June. So the application period opens on Monday, this coming Monday, and will close on the last day of the month, April 30th. Next. In case you are interested, you can read some of this information on the website itself. There is a lot of detailed information there about the application process and how we select our applicants. But just to highlight the broad points, as we go through and read applications, we're really looking to see what is the capacity for transformative leadership in a changing health environment for your particular idea and your leadership team. So we want to see, have you demonstrated leadership in supporting and advancing collaborative change already, as well as have you ever led the development of any kind of organizational level or even systems level change, either at your agency or in other ways. And you will receive that notification at the end of June about being selected. And again, the applications close end of April. So we hope all of you that have ideas and are interested in participating will go to the Kreski website, will fill out an application request form, and complete your application by that time. Next.
All righty. Thank you, Janet. We will take questions at the end, and that will also have Janet's contact information on that slide. Next up, we will have Julian Drix from the Rhode Island Department of Health.
Oh.
And he will share how they are using the Emerging Leaders in Public Health program to advance health equity in Rhode Island. Julian, you now have the floor.
Hello. Thank you. I'll do my best to move through this quickly. I'm excited to hear everyone's questions in the discussion at the end. Before I start, just to note that we are a little bit of different than some of the other members of the cohort in that we are a state health department, but we were eligible to apply for this amazing opportunity due to the fact that Rhode Island is a small enough state that we do not have any local or county health departments. We do a lot of our local health department work at the state level. So I'll be presenting today about our organizational work and a lot of the leadership that was really started by our director, Dr. Nicole Alexander Scott, who will be starting soon as the president of ASTO.
Oh my gosh.
We have a lot of exciting leadership work happening within Rhode Island that is having some national impacts as well. First slide. So this is developed by Dr. Alexandra Scott shortly after starting her tenure here at the Rhode Island Health Department of Health in 2014, and did some departmental reorganization and really has done a lot to really promote a health equity agenda across the entire department. So we were kind of organized around the overarching goal of really demonstrating the impact of public health and the importance of it and the purpose of it with 3 leading priorities. And as you can see, this is health equity across the board. So we're looking at addressing socioeconomic and environmental determinants of health, eliminating disparities of health and promoting health equity, and ensuring access to quality health services, especially for vulnerable populations. Part of the ways that we are moving towards achieving that is through some cross-cutting strategies, including the Rhode Academic Center, which is building close partnerships with academic institutions and bringing both students from those institutions to do work here at the health department and doing applied public health research at the health department. And then the other one is the Rhode Health Equity Institute, which built off of a lot of long-standing health equity work in some of the divisions across the department and brought it up to the director's office level as a cross-departmental effort, which is part of what we're building off of for our transformative concept, which I will get to in a moment. Next slide. So with those 3 leading priorities, this informed 5 strategies and 23 population health goals. I won't read
Brian,
these.
This is the Rhode Island people who are talking about how they did the health equity.
I'm sorry,
goal.
if you have not yet muted your line, could you please do so by pressing *6 or muting from your own function?
Thank you.
Thank you.
Glad that there's excitement. So I won't read through all of these population health goals and the 5 strategies, but this was started at the health department based on our health equity leading priorities and has been aligned with our statewide population health goals, with health system partners, with the SIM initiative, and really is a cross-state, cross-agency getting buy-in for moving our health system and our state as a whole towards health equity. Next slide. At the community level, one of the ways that we've been doing that for the past few years has been through health equity zones, which are place-based initiatives that we fund and collaborate with through the health department, that are community-led initiatives around a wide range, really based off of community needs and collective impact collaborative projects to be able to meet those community needs, including through policy change and environmental health policies, and really looking at the conditions, both social and environmental conditions at the neighborhood level. Next slide. So this is the infrastructure that's been in place and a lot of the effort we've been having around health equity with the creation of the Health Equity Institute. We're kind of creating this infrastructure from the state level down to the community level. We also have a Commission for Health Advocacy and Equity, which was created through the state legislature and is an independent body, but is connected and staffed by the health department with commissioners. And so we're really working on creating a system statewide for advancing this health equity agenda and implementing it. So this is where the Kreski ELF project comes in and our transformative concept. We have these lofty goals. We have a lot of work going on across the department and across the state just towards that. If you go to the next slide, the transformative concept that we proposed was to integrate social justice into everything the department does as the process to help us achieve our health equity goals. So really looking specifically at advocacy and policy change and what's the role for the health department to play in order to move us towards health equity in meaningful ways. So part of what we've been doing for our internal education of the department is what social justice is and how it's really always been part of public health, that it's been the foundation of public health from the beginning. And this is a quote back from 1842, so in the very early days of public health. And not just in the history of public health, but also for many of us who work in public health, that public health activism has been a motivation for advancing the goals that we want to see, and many of the successes that we've had have come through movements for advocacy, social movement change, and really basing that around the needs and especially the leadership of vulnerable populations. So this is very much a part of the tradition of public health, but it doesn't always get connected to it. Next slide. One of the efforts we have within the department, which was in a seedling stage informally and kind of led up to our application for the Kresge ELF Transformative Change Initiative, was an effort called the Social Justice Roundtable. So it started informally, a group of us in the department reacting to current events that are happening across the country, most specifically with events in Ferguson and the movement for Black Lives, but then kind of branching out and looking at many other different social justice issues and how they affect us personally and professionally and affect public health broadly. So we started looking around at what other health departments are doing with social justice. We found this definition of social justice that we really liked. Again, I won't read it to you, but we think it's a really great definition to really look at social justice as being a process. And this is from the Alameda County Health Department and their Place Matters initiative, which has been one of the inspirations behind what we're trying to do at the state level now. Next slide. So here are some of the things that the Social Justice Roundtable is seeking to do within our department. Creating space for personal and professional engagement on a range of social justice issues, addressing, developing, supporting recommendations for policy change, and from individual, programmatic, and departmental perspectives, finding better ways to support and empower initiatives and organizations as partners in the community. And this is where the transformative role for the health department comes in. We're seeking to create a health department that has sustainable change, that really pushes the envelope, doesn't shy away from doing what needs to be done and saying what needs to be said around issues that affect health equity and public health. We're not looking to reinvent the wheel, so finding and supporting existing initiatives, both within our state, but also learning from what's being done across the country, but also finding ways to lead by example and really putting it into practice, and supporting the leadership of those who are most impacted. And this is in terms of within our department and in the community, really looking at collective efforts, and that all voices are equal and valid, regardless of position or title, and that's within the department as well as in the community. Next slide. So this is, has been elevated incredibly through our participation in the Kresge ELF initiative, and the resources that have been provided through that, both in terms of leadership development, the action learning, and through the resource grant have been really incredible for advancing this. And some of those resources are going towards hiring consultants to do training in professional development, strategic planning with us. And one of our main consultants has been Human Impact Partners, who many of you might be familiar with. So they've created healthequityguide.org, which is an amazing resource. If you're not familiar with it, I recommend checking it out. And they also have convened Public Health Awakened, which is a network across the country of social justice public health advocates. So this has been exactly what we're looking to do, and they've been very helpful in working with us, helping us identify strategies in healthequityguide.org that we can begin implementing, and also beginning to develop training for our staff and for community partners. So I've listed a few of the trainings that they'll be doing with us. That we're really looking to create deep change within our department, which requires a lot of training and a lot of time to reach everybody across our 500-person plus staff. So we are doing a health equity visioning workshop, really bringing together people who are seeking to advance health equity across the department in different positions and leadership roles, program roles, and frontline staff, and really empowering those staff to be part of transformative change over the long term within the department. We're doing a train the trainer to really integrate social justice training into our long-term staff training when new people join the department in those roles. And then especially with community partners, we are working on health impact assessments as an example of a tool that can help advance social justice issues and policies in concrete ways. So this is a very useful tool. We have not done them in Rhode Island before, and so we're excited to pilot them with 2 local case studies with some community advocates that are working on these issues. We're doing one around an expansion of the Port of Providence, which is a health impact assessment looking at environmental justice, climate change, transportation related land use issues. And the other one is proposed legislation for $15 minimum wage and pay equity for the gender gap in income. And we're doing a health impact assessment of that to address socioeconomic issues as well. Next slide. Here are some of the other examples of what this transformation looks like in terms of implementing it. We've created an ELF leadership team, so it's led by the 2 of us, through the cohort, but we've created a leadership team across the departments to really work on implementing it and make it more sustainable and longstanding. We're working closely with the Rhode Academic Center to connect it to academic partners and scholarly work. We're connecting with another initiative, the Workforce and Career Development Network, and really framing this as an opportunity for career development, workforce development for all staff across the department. We'll be doing another training around strategic communications, working with the Praxis Project and Berkeley Media Studies Group, who are both very adept at social justice communications, not just how to communicate about health equity and social justice, but how to use our departmental communications to push for change in social justice issues that will lead to the health equity outcomes that we need, and really building capacity within our communications department and our Health Equity Institute staff. And we're working very closely with the Health Equity Institute and really institutionalizing a lot of these changes within that group, which reaches across the whole department. So the Health Equity Institute houses the Social Justice Roundtable, Sexual Orientation and Gender Identity Work Group, Community Health Resilience Project, as well as staffing the Commission for Health Advocacy and Equity, which is an arm. And we are somewhat limited. There's a lot we can do more around advocacy, but there are limitations to roles of what governments can or can't do around lobbying in particular. But these are things that the Commission, as a specific advocacy body, are able to do. And so a close partnership with them is very key. Next slide. And this is my final slide. These are just a list of some of the examples of policy topics. Social justice is a very broad area, so we're working in a couple of these areas more specifically, but really looking to have the transformative change and the new role that we're creating be able to address a wide range of social justice policy issues. Climate justice and resilience is one of the issues that we've been addressing so far with a number of proposed projects and community resiliency and adaptation plans across the state, and really getting health equity included as part of the governor's statewide resilience plans. And we brought a social justice leader from New York City to speak just last week using the funds from the Kreski Resource Grant to be able to talk about power dynamics and recovery, racial justice, racial equity, when it comes to resilience and adaptation, looking at what's happening in Puerto Rico specifically, but also applying those lessons to and learning from what's happened in this country, on the mainland as well, in New Orleans, in Houston, in New York City, and applying that to what we can do in Rhode Island to address equity and planning for climate change issues. Other issues we're looking at are gentrification and housing policies, how to promote development without displacement when so many of our health equity and public health achievements, if we don't plan ahead for this, can lead to gentrification and displacement when we're talking about farmers markets and bike paths and walkable communities, things like that. We need to really focus on gentrification and address that more directly. And so that's another issue that we're working on right now. We're in conversations with our hospital system partners and legal partners for legal rights, looking at immigration and sanctuary and promoting those as a public health issue, and then also looking at mass incarceration and police violence. So with all these issues, looking at what's the role for public health, there are social movements and community organizations working on all these issues, looking at policy change. What should public health's role be, and what should the role of a state agency and a government agency be in collaborating with, responding to, following the lead of, and creating leadership on these issues. So that wraps up my presentation, and I look forward to hearing your comments and questions at the end. Thank you.
Thank you, Julian. We will now have Margaret Reed of the Boston Public Health Commission. She will share with you how they're using the L program to do some transformative work in Boston. Margaret, you have the floor.
Thank you, Jessica. I always love hearing, we're so lucky that Rhode Island is next door, and we learn so much from them. We actually, a group of us did a field trip to learn more about their health equity zones, and we've been working with one of our hospitals on a very large determination of need that's rolling out. They're going to start distributing funds very soon, and they're going to be funding 3 health equity zones, which really in a large part resulted because we had the model of what was going on in Rhode Island. And just, for the folks that are listening, that peer-to-peer sharing is such a wonderful opportunity within this, the Emerging Leaders Program. In the interest of time, Jessica, why don't you just go to my third slide? Why don't we start there? So this is really important background information for how we do our work and the context of our work in Boston. Boston was found by the Brookings Institute to be the most income unequal city in the United States. We're the third most expensive city to live in if you're a renter, which is really important because we're also a very racially segregated city, and we have one of our historically black zip codes, the 02119 zip code, is 82% renter. So the vulnerability to displacement and the rapid gentrification and displacement that's going on in our community is it's very disabling. Why don't you move to the next one? I'm not going to read our mission and vision. Our mission is really to focus on the most vulnerable residents in Boston, and we are a majority people of color city, and a lot of our racial and environmental vulnerabilities really are residents of color share a very unequal burden. So many of our efforts are really focused on our residents who are Black, Latino, Asian, immigrant. And our vision is really a social justice vision. I don't need to read it to you, but it's about ending oppression. You can move to the next one. In 2017, our executive director, Monica Valdez-Lupi, started a planning process around 3 strategic priorities for the organization. It engaged many of our 1,100 employees from every bureau and every strata of leadership, and also our Board of Health and the community. One of the strategic priorities is advancing health equity, and our 3 goals are around expanding understanding and dialogue of what creates health inequities, supporting comprehensive place-based strategies, which I just mentioned a moment ago, and strengthening our workforce development opportunities so that all staff have the opportunity to integrate equity into practice. And I will say a lot of our practice change focus is not just around how we do programs and services, but how we do our business, looking at hiring and retention and promotion so that we are really advancing Boston residents of color, our procurement so that Boston residents, small companies, Bostonians of color can be economically engaged with us. You can move to the next one. And then our transformational goal really builds on these priorities. The goal is to become the change agent for incorporating health equity into both BPHC practices, but into city practices. We want to change our organizational processes to better align with our values. We want to engage our other city departments in this vision and these change efforts, implement our new community engagement strategy, which I'm really going to use. I'm going to walk through our first experience with that. Collect and share our health and social determinant data so that it's really a tool and relevant to others for decision making and for advocacy and organizing. To improve our communications capacity so that we can better communicate concepts of health equity, social determinants, and racial justice, and again, make them relevant to decision making, and to capitalize on the distinct roles of our executive director, Monica, and myself. And really, the ELF, these objectives, they look ambitious, but they're really designed to advance our health equity strategic priority and to accelerate progress around that priority. So this is a busy slide, and I'm not going to walk you through it. I just wanted to call out a couple of things. We went on the inputs. We went into this with a lot of internal capacity and have been building the foundation for this for a long time. So the Emerging Leaders in Public Health was a really timely opportunity for us. And it really provides the time and the resources around leadership development, around sharing with the other communities, and just, I would say the opportunities, the travel opportunities are one of the things that's great is it allows myself and our leader, Monica, to really sit down and take ourselves out of our day-to-day work and discuss and think and plan and learn from others. And the financial resources, as everyone knows, are really critical. And they're providing, they're accelerating and providing visibility for our work. Through the leadership development opportunity, we're both right now thinking a lot about how we lead our staff to become more comfortable with change and to be more innovative and less afraid of failure. We used some of our resources to actually go to a General Electric leadership training center. We are now the city that headquarters them. And we really learned how they have actually institutionalized innovation and how they protect innovation and support and incorporate failure into their work, how they do their work. And at the recent convening of our cohort, we heard a lot from the other communities about their leadership teams, and it really was a foundation for Monica and I to start discussing how we can better engage and involve our senior leadership team and our program directors more actively. It was kind of suggested to use one strategy as an example of our work, and I'm just going to talk in the next couple of slides about implementing our new community engagement plan. And the plan's a guidance document, and in the guidance, it requires baseline assessments on some of our community engagement practices. And based on the assessments, we're identifying technical assistance, training, or quality improvement needs to then move us to a place where we have standard community engagement practices across the organization. Historically, we do annual community meetings every year. They're an opportunity to hear about community concerns, to identify emerging issues, and to also share health data from our Health of Boston, which we issue every other year. Our first activity with resources from Kreski and implementing the new community engagement plan was a series of community meetings we held last summer. Our community engagement plan includes two new things for us, well, a lot of new things, but the two I'm going to highlight here are engaging with non-traditional partners. I call them people that don't know they're practicing public health, organizations that are organizing around housing, around jobs, around minimum wages and education, for example. And then the other priority was to really start using our data to inform decision-making and to support activism around social determinants of health. You can go to the next one. So this new community engagement priorities really drove the planning and implementation of 5 community meetings that we co-hosted last summer. Again, we want our data to be used for decision making, so we had the opportunity to work with our other city housing agencies to do the community process that was required for a HUD fair housing assessment that the city was required to do, which HUD is requiring these of cities, and their community engagement requirement had actually become much more robust. Since community engagement is a public health function, we were really able to bring a skill set to the process. And we were able to really contribute a lot of our data to the process. Our data ended up in the community assessment, the fair housing assessment, which results in a proposed fair housing plan. So our data actually was used in this, and also it was an opportunity for community-based organizations to see that we actually have vast amounts of data that is housing and health data, so very relevant to them. 211 people signed into the meetings. We did them in 5 neighborhoods. If you don't know Boston, that might, I won't list out the neighborhoods. 50% of those that signed in self-identified as Black or African American, and another 1/3 self-identified as Hispanic or Latino. So we can move to the next one. And I think this is my last one. You know, the fair housing assessment required that all participants be surveyed, and again, that the survey results are included in the assessment report and also are then addressed in the fair housing plan. So all this relevant, what you see on these slides is, of course, this was a housing meeting full of people that are housing vulnerable and the groups that work to organize and advocate for them. And the most noted barrier to their housing accessibility was affordable rent. But then all these other issues surface that have to be addressed, and that we are able to contribute relevant data to. The issue of access to good jobs. Boston also, it's been studied, and we are a very transportation inequitable city as well. Black commuters in Boston spent significantly more time than white commuters commuting to work, which is affects their ability to have jobs. Access to food, access to good education. So all of these need to be addressed in the report, which is, again, a planning document. So this was a great first effort for us. We're already planning our next series, which is around violence prevention, and we're planning with our police department, our public schools, and our centers for youth and families. And the one other thing before I close that I would say that was really, I think, a great experience for us is that, working with these new types of community organizations really was a challenging experience for us. We had to demonstrate our value, which is, part of the point of the ELF, and we had to interact with them differently than we actually interact with our traditional public health advocates, because they have a very different relationship for the city. So it was a challenging experience for us, and it was a really a great learning opportunity. So I'll finish there.
Thank you so much, Margaret. I just want to say thank you to all of our speakers. We do have about 5 minutes left in our time. For any questions that you may have, you can ask questions by coming on the line. You can do that by pressing *7. Or you can enter your questions into the chat box. And once again, to unmute your line, please press *7.
Hi, this is Bruce Parsons from El Paso.
Hi, Bruce.
Hi, I just had a question for Julian. Could he explain a little bit more about this concept of kind of leading by following?
Yes, sure. I think especially when it comes to issues of inequity and inequality and the role that government policies and institutions have played in oftentimes historically perpetuating those. I think redlining being a really key example of a government policy that has resulted in ample ongoing inequity to this day. But with any kind of issue, I think we have ample data showing and knowing which communities are most impacted, and we're really good at breaking that down. But we're not necessarily as good at following the leadership and taking seriously the ideas and the solutions for change of what to do about that. Sometimes, whether it's government agencies or even social service or nonprofit organizations can operate in this kind of modern day missionary almost type of approach of coming in to save somebody when I think there's a lot to be learned about people can save themselves and there's a quote I'm gonna have to paraphrase it. It's from a woman in Australia, an Aboriginal woman, saying if you come here to save me, you're wasting your time, but if you come here understanding that your liberation is bound up in mine, then let us work together. So I think that kind of shared leadership and support for grassroots community solutions is a really key part of creating change and not imposing it. And I think in terms of some of the kind of specifics of what does that look like and how to support community leadership, there is a very short document called the HEMEZ Principles, JEMEZ. It's the HEMEZ Principles for, I believe, democratic organizing or community democracy, something like that. And it was created as a guideline for how to work in partnership with communities and create just relationships, allowing the most impacted to lead. So I think that's these are across the board, and it was created from the environmental justice movement, more so in relationship to some of the big green organizations, conservation organizations, and really emphasizing the need for environmental justice communities to take leadership roles in determining what kinds of solutions would be effective. But I think it applies as well, and I know that there's some other resources there. I'm sure GARE, the Government Alliance for Racial Equity, has some good tools around this as well. Human Impact Partners, who I mentioned, are really good at in their healthequityguide.org identifying kind of strategies and ways and practices and policies and techniques of how to create more accountable and just relationships with community partners so that it's changing the power relationships and really working together on solutions. Did that answer your question?
Bruce said yes. Got a note from him in the chat.
Thank you.
All right. Do we have any other questions? You can unmute your line by pressing *7 or put your question into the chat box. I did receive one, and just so you know, we will be sharing this recording and the slides with all of the participants. Okay. So I'm not hearing any questions. If you do have any after we get off the line, feel free to email me or email any of the speakers. I'll send an email with everyone's information. Once again, I do want to thank Janet, Julian, and Margaret for a wonderful presentation today, and I hope you all gathered some new and innovative ideas on how to promote health equity within your health departments and communities. Janet, thank you for sharing this opportunity with our members with the Emerging Leaders in Public Health program, and I hope you all do get a chance to apply. Like I said previously, we will share the recording in the next few days, and thank you all for joining us this webinar. Have a wonderful Wednesday.